So yeah, my name is Ben Waghorn. I'm the VP of Product Management and Clinical Operations at Vision RT, and I'm really excited actually talking about Halloween and being scared. We've got a great product I think we're going to show you today that's going to help reduce that level of being intimidated or scared during treatment planning. And the format of that really is via a solution of clearance mapping during the treatment planning process to help reduce the chances of collisions between any equipment and the patient, and in doing so to also enhance treatment plan quality. So we've been on a great journey over the last several years in partnership between Vision RT and RaySearch to really bring this together and offer a solution that can hopefully benefit all of you out there today. So when we think of surface-guided radiation therapy, so SGRT, which is what Vision RT specializes in, probably many of you first think of the application of patient motion management, so using optical cameras in the treatment room to actively track the patient during setup and treatment delivery. So using these cameras, we can reconstruct the patient's surface and see where that patient is relative to where they're supposed to be and make sure they don't move during treatment. So that to date is maybe the most common application and thing people think of. But there's a lot more we can do when we can capture information about the patient and their surface. One of those, which we're going to be describing today, is the stage of treatment planning. So as we know, there is always a risk of having a collision or a non-deliverable plan for a patient. So how can surface guidance, how can information about where the patient is and essentially their envelope be used with these optical techniques to bring together with the treatment planning space? So this is what I'm going to be introducing and talking about for the rest of this little presentation. Okay, this may be a rare presentation on this booth of RaySearch, but I'm not going to show a single DVH. So for those of you who are fans of DVHs, I'm sorry to let you down already, but the principle is going to be very similar. What are our goals with treatment planning? We want to obviously deliver the dose to the target as conformally as we can, but we also want to spare our healthy tissue, our OARs. So there are many, many great techniques now to really help drive this such that we can deliver that healthy tissue sparing, but it comes at a cost and a consequence. And some of those include the skill required, the time required to deliver or create these plans. And the risk is the piece I really want to talk about more here. So in this example here, if we CT scan the patient like we normally do for the first step of the treatment planning process, and we create a good-looking treatment plan, the question is, what is the risk of collision with that plan we've created? The dosimetry looks great, but with this limited set of information, can we confidently say whether or not this is deliverable? And if it is, can we push this a little bit more to get a better plan, maybe some more non-conformal, non-coplanar arcs, for example? So this is exactly where MapRT comes into play to help answer some of those questions. So just to briefly give you an overview of what the MapRT solution is, this relatively new SGRT technology, it really starts off at the treatment planning stage. So while the patient is undergoing their CT simulation, while they're in the treatment position that you're defining, we can use cameras from Vision RT to capture the full surface outline of the patient and the accessories they're laying on and capture that in their treatment position. So we get the full envelope of where the patient is and the position they'll be in. We then take that surface, the clinical user yourselves will define where that isocenter is, and then we can place the surface into a virtual treatment room that will generate for any of your treatment systems. So in this example here, we've reconstructed our virtual treatment space with the patient in the correct location. And then the final step is to generate a clearance map. So here we have our virtual treatment room, and in the center here we have the clearance map, which shows on the x-axis the couch angle, so as you rotate the couch, and on the y-axis the gantry. And the important information here is where we have these collision zones in red, where we physically cannot deliver beam without risk of collision. But the clear space in between is what we want to really focus on. So this is a tool that can be used during both the planning process up front and also as a final check to make sure that any plan you've generated is actually deliverable. So an example here. If you can see these yellow lines, these are coplanar arcs in the center here. So there's two short arcs. And then the yellow dots that come across are individual static fields at these various angles. So in this example here, this little illustration, we can see that there are a couple of fields, static fields, that reside inside this collision zone. So these are physically, we wouldn't be able to deliver this plan. So this essentially gives us a virtual dry run of this plan. And at this stage, we would not go through or continue with the planning process with this fields. We'd move some of these individual beam arrangements and get a more optimal plan that's actually deliverable. So back to my initial illustration I gave a second ago with the question of, we have a great treatment plan. This is what the user sees. This is the information they have. Is this physically deliverable? Well, we can answer this, and this is exactly what Dr. Dave Parsons did at UT Southwestern. Without MapRT, you maybe look at this and say, yeah, I think this looks okay. This should clear. We've got a coplanar arc and a small couch rotation with another arc. Yeah, I think we can go ahead with this. So in a traditional workflow, you'd bring the patient in for day 1 of treatment. You'd try and simulate this setup. And whoops, it doesn't actually clear. Even the coplanar arc, in fact, in this case here, the patient's elbow, once we use MapRT to assess this, is causing a collision between the gantry as part of that arc and the elbow. So because MapRT has the full surface information, we're able to now assess whether or not the plan is deliverable and optimize the plan based on that information. So in this case, the team at UT Southwestern, they shortened the coplanar arc and then pulled back the non-coplanar arc slightly, such that this plan is now able to be delivered confidently. So they had good plan dosimetry. They were able to use their non-coplanar arcs to get better dosimetry with the confidence that this plan, as soon as they get to a treatment machine, is deliverable. And in fact, they have eliminated actual physical dry runs on the machine in lieu of being able to do this virtually. So a single click, they can confidently say whether or not the plan is achievable. So this is where we lead into the collaboration, I think very successful collaboration we've had between VisionRT and RaySearch. So what I've just described to you now is the MapRT solution, which can exist completely by itself. It's a browser-based solution. You can send DICOM data from the treatment planning software to MapRT and get all the information I just described. But wouldn't it be great if we didn't have to take that additional step if you're a RayStation user, and all of this information could be provided at the time of treatment planning directly within RayStation. So long before these products were released, this is many years ago, I think even pre-COVID, we started having these discussions between our two companies of, we feel this will be a great clinical tool for the users out there to really helps facilitate both better treatment plans and also the confidence of delivering these plans safely. So how can we integrate these two together? You won't be able to see all the details of this on the screen, I'm sure, but I'll just talk you through a little bit what the RayStation interface looks like with MapRT integrated. So here we have an example where there's two coplanar arcs and two non-coplanar arcs within this treatment plan. So you'll see now integrated within the RayStation software is the ability to import the surface that's captured by MapRT for this treatment setup. So we select which surface is applicable to this patient. We can name this surface, and then it will display within the contours this full external body outline directly within RayStation. So we see this popping up here. So now we can visualize the patient's outline, so we get the full envelope versus just the DICOM data set. And we can see this as well as a contour within these other views. The next step then is to calculate the clearance map. So this is a one-time occurrence where the user can first of all define what margin are they comfortable with. Do they want to have a 2 centimeter, for example, margin at all times between any risk of collision, or 3 centimeters? Whatever the comfort level is there is configurable. So in this example, the user has selected a 2 centimeter margin around the patient and around the couch. And based on that, all this information we now have, we've calculated our clearance map. So this can be expanded. We have all the information I was describing earlier directly in RayStation. And the value here is that instantly we have a clearance check directly within RayStation. So all of these fields clear. If any changes are made to this, it'll update in real time whether or not those changes, if you extend an arc, for example, are actually still deliverable without that any risk of collision. We can visualize these within the clearance map as well. Again, this can be expanded. So maybe there's a dosimetric benefit of extending an arc slightly. So rather than being conservative, if you don't have this information, you can look at the impact of extending an arc or maybe adding an additional couch rotation. So I wanted to give one clinical example of this. This is from one of our joint partners. This is from Regmore Hospital in Scotland. So their team, they've had many examples, but I think this kind of illustrates it nicely. So a lung treatment plan. They designed a good plan based off of a coplanar arc and then a vertex field with a 90-degree couch rotation. Without MapRT, look at the dosimetry, everything looks good, try and be conservative. But as soon as you now bring this data into the RayStation platform, we can see the coplanar arc in this example clears nicely. We have no risk of collision. But our couch kick, we just move slightly into the collision zone. So even though it's only a slight deviation and a slight risk of collision, a collision is a collision. We don't want that to happen. So in this clinical case, they can see very clearly, if they just reduce the length of that arc slightly by a few degrees, we go from a clearance check of not passing, we reduce the gantry angle slightly in the arc, and now this is physically deliverable without risk of collision. So as you saw, when they made that small adjustment, it was instantly updated within this integrated solution to show that this is deliverable. So there's, with this interface, this integration, there's no more back and forth to the MapRT for users, so they can benefit from this directly. So going back to the initial kind of introduction I had on this, again, quite often the slightly more complex treatment deliveries will result, treatment plans, will result in better dosimetry, particularly when it comes to avoiding these critical structures. So the work that's been ongoing for years, like I stated before, has really delivered a tool now that fits right into the existing workflow of RayStation users, bringing in this additional information now from MapRT to provide this real-time clearance mapping. So what does this deliver? The opportunity to eliminate physical dry runs. Any of you clinical users, I'm sure you've had occasions where you bring in a patient for day one of treatment delivery, you realize that actually there is a risk of collision, the plan's not deliverable, you have to send the patient home, apologize, replan, bring them back another day. It's an expensive, unfortunate case, but it happens. With this tool now built into RayStation, we'll be able to eliminate that likelihood with this virtual dry run. And in doing so, we can also be less conservative at the planning phase. We can actually use this now to know where we can deliver beams from, be it coplanar, non-coplanar, or otherwise, and create a better plan for the patient without adding any complexity or time. So I think there's several examples of where this adds value. We're already hearing back from the early adopters of this technology, but ultimately it's really allowing us, with this additional information of where the patient is, to drive down this risk category, not just providing a better opportunity to deliver beams from different angles, but also reducing potentially the level of skill needed to deliver some of these plans, because you don't rely on that experience of knowing where the patient or estimating where the patient is during delivery, but actually having that information directly provided to you through this MapRT interface. So hopefully that gave a good overview of the individual solutions and how, when we bring them together, the synergy really adds additional level to the end user. And hopefully you can see the value of having this full surface map of the patient when it comes to treatment planning. So thank you very much. I'm happy to answer any questions.
Thank you, Ben. Thank you. Well, if we do have any questions, please raise your hand. I'll come to you, and we'll make sure that the question is at least being tried to be answered. But
I'll
I have a
try.
little question.
Yes.
So you said that it all started a long time ago, the collaboration between VisionRT and RaySearch. Now, respectively looking into that, would you still think it's worth it all
Oh,
these years?
100%. Yeah, I mean, this is knowing what we know now, of course, about the value this product offers to, I think, clinics around the world. It's very clear the feedback that this is something that is missing in planning today, at least before today. So our vision of where this could take us, we've demonstrated that the clinical users have demonstrated that. So absolutely, we would have done the same again. And I think it was a very successful journey together. Took a leap of faith a little bit because it was new approaches for both companies coming together. But I think with the shared vision, we were able to deliver something that hopefully will demonstrate to be very valuable.
And do you have any already? You've mentioned a little bit the clinical use that's happening in Scotland, but do you have any examples of reactions of some users when they were seeing that happened? So the integration happened.
Yeah, I mean, it's a very common question we get when someone first hears about MapRT is like, well, how does this integrate into my current workflow? So users, when they hear that we have this integration available with RayStation, they're like, wow, that's great. That's exactly what we want. Ideally, users don't want to be looking at two monitors, having two separate workflows. So the more we can integrate these technologies, it's just a better solution for them. And having it update in real time as they make adjustments to the treatment plan, obviously that adds even more value.
Yes, I agree. I have one example from our side. I just heard. So we just had our user meeting in UK, and I don't remember exactly who that was, but it was a person using MapRT and RayStation, and she said, "I love MapRT, and I also love RayStation, and now I can have both in one screen." And I mean, that is what
great.
it's all about, right?
Absolutely.
It's having these reactions and having these benefits for users and eventually for patients as well. Last question: can we come and see the MapRT in live here?
Absolutely.
Yeah?
In fact, we got two choices for you, and you're welcome to come to both. But yeah, we have live demonstrations of MapRT at the VisionRT booth and also on your booth with RaySearch. So yeah, we're very happy to welcome you both places and answer any questions you may have and give a live demo.
Great. Happy to hear. All right. Thank you, Ben, so
Great.
much. Thank you.
Thank you all.